When you have a tooth extracted and don't replace it, the bone that was there to hold that tooth in place begins to dissolve and disappear, because the only purpose of that bone is to hold the tooth in.
Okay.
So once the tooth is gone, the bone starts to shrink away. So the teeth on either side will tend to tip into that space. The tooth above it will tend to drop down. It's sort of like pulling a brick out from a wall where everything starts to collapse in. When you're missing teeth, you tend not to chew properly, you tend not to eat your food properly, so it could affect your how you're nourished. Well, some people feel embarrassed when they're missing teeth, and they'll tend to not smile. They'll tend to hide where that space is. Okay, so if somebody is missing a tooth, the options are to replace that tooth with an implant. Implant meaning an artificial root with a crown that is either glued or screwed on top of the implant. An implant is an artificial root. That's the best way to go. It's the most natural. It's the most like having your own teeth, and also it's conservative in that you don't have to drill or cut down any teeth. A dental implant lasts for a long time, probably longer than any of the other procedures that we do. An implant may last you your whole life.
Okay.
The crown that's put on top of it may occasionally need to be replaced over the years, but the dental implant itself should last most of your life. Again, it's the better way to replace teeth. It's the most natural. In general, it's $4,000 range. With payment options, that can be spread out over 6 months to a year. Some insurance plans will help pay towards the implant and the crown. You're best to always assume that the insurance company doesn't pay, but some will help.